Hello, I'm Dr. Joshua Tay. Nasopharyngeal cancer, also known as nose cancer or NPC, is the third most common cancer among middle-aged men in Singapore. NPC is 3 times more prevalent in males. Patients are more likely to be Chinese or Malay, and typically between 40 to 60 years old, a stage in life when many are at their peak, professionally and socially. Risk factors include an Epstein-Barr viral infection, a family history of nose cancer, and a diet high in salted fish or preserved foods. The nasopharynx is located at the back of our nose, near the eustachian tubes which connect the nose to the ear. As such, one of the most common symptoms of NPC is a sensation of persistent blockage or ringing in the ear. Because the nasopharynx is located just above the throat and behind the nose, another common symptom is persistent blood stains in the saliva or mucus. Lastly, patients with NPC often develop swelling in the neck due to the spread of cancer to the draining lymph nodes. In many cases, NPC is treatable, and even more so if diagnosed early. Seeing an ENT doctor early for a comprehensive evaluation is crucial. During your visit, the ENT doctor will ask about your symptoms and conduct a thorough examination. This includes checking the ears for fluid behind the eardrums, examining the neck for lymph nodes, and performing a nasal endoscopy to examine the nasopharynx. Your doctor may also suggest a nasopharyngeal biopsy. This is a common procedure performed in the ENT outpatient clinic under local anesthesia. Using an endoscopic technique, a few tiny tissue fragments are taken, typically 3 to 4 millimeters in size. The procedure is safe, and the risk of bleeding is low at 1% or less. The tissue sample is then sent to a pathologist for evaluation, and results are usually available within a week. Nasopharyngeal cancer is one of the most treatable cancers. When detected early, survival rates are excellent. Early stage NPC is treated with radiation therapy alone. The survival rate is over 90%. For more advanced stages, chemotherapy is given alongside radiation therapy. Depending on the stage of cancer, survival rates range from 60 to 90%. Even in very advanced stages, treatment options are available, including immunotherapy, targeted therapies, and clinical trials. If the cancer recurs, surgery is an option. Endoscopic surgery is used for tumors in the nasopharynx, while open surgery may be necessary for affected lymph nodes in the neck. If you have a parent or sibling diagnosed with NPC, you are at higher risk. However, this is not necessarily bad news. In a cohort study we conducted, first-degree family members were enrolled in a screening program, and nearly all NPC cases detected were in the early stage. With this in mind, it is important for adult first-degree family members to be screened. This can be easily done using an EBV antibody test as a biomarker, along with a yearly clinical examination. For individuals without a history of NPC, there is currently not enough evidence to recommend routine screening. Nasopharyngeal cancer is a treatable disease, and early detection can make a difference. If you are experiencing any of the symptoms, see your doctor immediately. Thank you for watching.